Okay.
Okay. So you are at working the baseball game
Okay.
at High Point University, and your umpire behind the plate just collapsed.
Okay. Now, go.
Hi. Are you okay? You good? Oh my lord. Oh my lord.
Okay.
Not breathing.
Okay. Tell him to call 911.
Huh?
Tell him to call 911.
Call 911. Dorian?
EMS, go ahead. This is Dorian over at High Point University. I have a umpire now, not breathing, non-responsive.
Okay. You have the EID?
Yep. No.
Copy. What is your exact location? We are at 870 Circle.
AD, can you make sure?
17,
AD?
24,
Copy.
25, 26,
870 Circle. How old?
30.
Can you make sure no one gets near the scene?
I would say
Okay, this is not.
Caucasian male.
What the hell?
One, two,
This is
Okay,
different.
Corey, you said the patient is not breathing, not
No pulse.
No pulse, non-responsive. Okay, we'll initiate the
Stay
CPR
calm.
instructions.
Follow
Caller,
these
you
voice
guys
instructions.
performing CPR?
Make sure 911 is called now.
We are.
Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the two locations
Coming
shown.
around you.
36, 37,
Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location exactly as illustrated.
Let me know if you need to switch.
Press pads firmly to patient's bare skin. Do not touch patient. Analyzing
Step
heart.
back.
Press pads firmly to patient's bare skin. Press pads firmly to patient's bare skin.
Is that one down?
Press pads firmly to patient's
is.
bare skin. Do press pads firmly to patient's
It
bare
is
skin.
on.
Do not touch patient. Analyzing
Do
heart
not touch
rhythm.
it. Clear.
Please wait. Press pads firmly to patient's bare skin.
Recognizes.
Press pads firmly to patient's bare skin. Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch patient. Analyzing heart rhythm. Please wait. EMS.
Don't touch.
Do not touch. Preparing shock. Move away from the patient.
Clear.
Preparing shock. Move away from the patient. Press red flashing button
Plus
to
button.
deliver shock. Shock delivered. It is now safe to touch the patient. When instructed,
Check.
give patient 30 rapid compressions. Then give 2 breaths. Place heel of one
No.
hand on center of chest
No.
between nipples.
2.
Place heel of other hand directly on top of first hand. Lean over patient with elbows straight. Press the patient's chest down rapidly, 1/3 depth of chest, then release. Start CPR. Press, 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 press. Stop compression. Give breath.
1, 2, 3,
Give breath.
4, 5, 6, 7, 8.
Continue with compressions.
Let me know if you need to switch.
Press, 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 press,
Switch.
press, 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 press. Stop compressions. Give breath. Give breath. Continue with compressions. Press, 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 press,
What's up, my man?
press,
I'm gonna be squeezing by you, okay? Can you move that back for me?
press.
All right, so I heard that we have been doing CPR for about 2 minutes now.
Yes.
Stop compression.
All right, go ahead and get my airway set up, please.
Give breath.
Okay.
Go ahead, Brandon.
Give breath.
How many times have y'all shocked?
Just once.
Continue with
Once.
compression. Press, press.
So what we're gonna do is I'm gonna get this turned on and get my pads on,
Okay.
and we're gonna see what we got from there.
Okay.
Do we know anything about this patient? Medical history, allergies, anything like that?
No.
No.
Press, press,
Okay.
press.
I got you. Well, keep doing what you're doing. What we're gonna do is Zach, go ahead and unzip it for me.
Compression. Give
And
breath.
Kimber, if you
Go
can,
Give
after
breath.
that, go ahead and hop and get my go bag, please.
Continue with
And
compression.
get out my BBM. We're gonna switch to that.
Press, press.
So you keep working. I'm gonna work around you, okay?
Press, 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 press.
Yes.
All right, so you're gonna learn today.
Press, press.
All right, watch out.
Press, press.
All right.
Press.
Keep doing CPR.
Press. Stop compression.
You can turn this off. So what's your
Give breath.
All right, here's your
so once
BBM.
she's done with that, you're gonna be back on the
Give
chest,
breath.
and you're gonna be doing it after him, okay? Because
Stop
he's gonna get tired here in a
CPR.
second.
Press
Right.
pads firmly
Go
to
ahead and switch
patient's
out.
bare skin.
All right, you're good. So
Press
start your
pads
CPR
firmly
again.
to patient's bare skin.
Jimmy, I'm gonna work on the NIO.
All right,
Press
that's fine.
pads firmly to patient's bare skin.
All right, sounds good. Have you dropped an MPA before?
Press
Yes.
pads
Alright.
firmly
So you
to
keep
patient's
bagging?
bare
Okay.
skin.
And how often are you bagging that patient?
Press pads firmly
Huh?
to
How
patient's
often are you
bare
gonna BBM the
skin.
patient?
Oh, 2 breaths after 30 compressions.
Press pads firmly to patient's bare skin.
You're good. We're not using that one. Keep
Press
going.
pads firmly to patient's bare
You can go ahead
skin.
and turn your AED off. I got mine rolling right now.
Cool.
Can you get your phone
Press
out for a
pads
timer for me?
firmly.
We're
Do
gonna be
not
doing
open
CPR,
lid to continue
all sorts of
rescue.
stuff.
Coming right next to you. You keep doing what you're doing.
How do you turn this off? Kimber, up there.
Okay.
I'm gonna hand you this. If you can drop that here in a second, okay? The
Alright.
packaging should be behind you.
Copy that. IO in place.
Yeah, that's fine. I didn't see the MPAs in there.
We have rhythm check yet?
No, so
Nope.
he's got a 2-minute timer.
Okay.
We can go ahead and stop compressions. We'll do a quick rhythm check.
Pause.
There's.
It's like VFib.
All right, so I'll go ahead and.
They're charging. Let's get back on that bags. We'll let you know when they're clear.
All right, charging up right now. 360. Everyone clear the patient.
Clear.
All right, shock delivered. Back on the chest.
Shocking. Go ahead.
Go.
Back on.
All right, we're gonna go ahead and get this Lucas on next. Hold this for me, please.
All right. Step aside here. I'm gonna place that.
All right.
All right. Shoved in. Right there.
And you got the timer? All right, so we just did a rhythm check. We're doing 2
Works
minutes
for
from
the
that
two.
rhythm check,
Yes.
okay?
All right.
All
I'll
right.
have you support this.
Okay.
It's in there. Okay. All right. And you can
I'll take that
bag
from you.
Okay.
and just hold like that. Yep. And now we've transitioned to 1 breath every 6 seconds.
Okay.
Continuous, and we're continuous compression.
That's it. So once every 6 seconds. What we're gonna do here in a second when our next rhythm check happens is we're gonna get this Lucas device under, so that way we can go ahead and.
What's
Get
wrong?
this
What's
on.
wrong? What's
Cooper.
wrong? What's wrong? What's wrong?
What's going on? What's going on? What's going
No,
on?
you can't take me. You can't take me. You
And
can't
back.
take me. No, what's wrong with him? What's wrong with him? What's wrong
Can
with
we get
him?
an officer up here?
No. What's wrong with my baby? No.
Ma'am.
No. What's wrong with him? Tell me what's wrong with
Thank you.
him. No.
All right.
No.
We'll say it's time for a pulse check real quick. So what I'm gonna do is I'm gonna get right here. I'm gonna slide this underneath the patient. If you can support the neck real quick while I do this. All right. Thank you.
Okay.
All right. Looks like asystole on the monitor. We can start bagging the patient
Okay.
again. And if you start doing CPR while I get this Lucas device situated.
I'm gonna send this first epi. All right, Jimmy.
All right, go ahead, man. So this is gonna go in here like this. I can move this out of the way.
Back to a 2-minute timer. First epi in.
Okay. You want to watch out just real quick? This latch is over here. We're not actually going to turn it on,
Okay.
but
You can switch with Brandon.
what you can do is this lowers down to the chest. When you push that button, it starts doing compression.
Just putting
Okay.
this on.
So-
Okay. And
All
the-
right.
Okay.
Great. All right. So we can kind of have everybody move a little closer. If you were in this group, so Cooper, come on in here as well.
Oh, that's not right.
All right. MJ, are you able to bring the camera up closer to us for this? Okay, that's fine.
Uh,
That's fine.
She said they can hear everyone.
So, the aftermath. It's a little bit of a hot mess of a scene, isn't it? Okay? There's a lot going on. So what we want to do here is kind of pause and go through just a quick debrief. Okay, this is almost like a cortisol dump. Let's get all the stress out from it. Okay, and so let's start with what we think went well. And I want to hear from the members of the group first.
Okay. You got on the
Um,
chest fast?
I thought we got to the chest fast.
Yeah.
I was not familiar with this AED, so it took me longer than I expected to get the AED open and on the chest.
Okay.
So that probably could have gone better.
I think overall it was pretty good
Yeah.
communication between Molly and Brandon, just deciding who was going to do CPR, who was going to do
Yeah, we
the
talked
rest.
before who was going on chest, who was doing AED.
Great. Okay. So even though you
We
felt
switched
delayed
well.
in it, I mean, you were on the chest. You had it on within 3 minutes.
Yeah.
I would say. I mean, I'm guessing. Haven't looked at the timing, but I'm going to say within 3 minutes you had it on, so that's still good.
Okay.
And definitely CPR within 3. Okay.
I thought we switched pretty smoothly, which that's what I'm not good about. So I
Okay.
thought we did that pretty well.
Okay. Who called that switch?
I did.
You did. Great.
Yes.
Okay. Great.
I just tried to let her know I was
Yeah.
there whenever
You were
she
there.
was ready.
Great.
Yeah.
Okay. Awesome. Billy, things
I was gonna see if they had anything.
things that you guys thought they did well.
I think they stayed very calm. Like from our point of view, like y'all didn't seem like you were rushing or anything. You stayed very calm.
I feel like they just didn't really like pay attention to the mom running onto the field, which was like really good. Like they didn't let that get in the way
Okay.
of giving care.
Did that throw you a little bit?
Respect to the crowd. Probably in our EAP, I should have gone to find a relative or somebody, a guardian of the patient, so that I could confidently answer that wouldn't happen in the first place.
Okay. Okay. So kind of move it into
Just something I
some
would've done better.
things we would do differently. Yep.
Getting everybody involved was pretty seamless. I felt like CPR.
Yeah.
Yeah, we talked before that they were
Yeah.
certified.
And so, Maddie, what is your role for everybody in this case? What were you?
I was a coach.
She was a coach. Okay, but all of our coaches are
CPR
trained in
certified.
CPR, so that was totally cool. Like to say, hey, you're here, let's go.
From an
Yeah,
EMS perspective, what'd you guys like? Give us one or two.
The communication on the radio is really clear, very good.
Story.
That
Yes,
does not always
Papa.
happen.
Yes, Papa.
And I kind of waited for a second to ask for that cross street. This dispatch will do that. So you said the right things initially. You said not conscious, not breathing. That's good. They're going to send people immediately for that. So the only note I have on that is identify yourself as like someone that's trained and not a layperson, so
Yeah.
that it sometimes will cut you through on dispatch a little faster. Like they won't ask you so many questions.
What I thought was good is that your name,
Maddie.
Maddie, met us at the truck, which was good.
Yep.
Some people will
Yes,
look at us
Maddie.
and are like, what are they doing? They're taking forever. But you came and you briefed us at the truck. And even though it takes us 15, 30 seconds to come here, I got so much information in that 30 seconds walking up here. So that was
Maddie,
solid.
yes.
When we got here, it seemed like it was a well-oiled machine. My man was on CPR. You were ventilating the patient, which was fantastic. And so you were doing the 30 to 2. You were also doing CPR with the machine, which is exactly the rate that we need, right? And then once we got in here and started getting to work, y'all were really hands-on with us as well. Whenever I asked Dorian, said, hey, can you unzip that for me and get that out? He was on it. When I gave him my phone and was like, hey, you're keeping a timer, he was on it. So y'all didn't let the scenario itself kind of eat you up too much. Some people can get so kind of condition black. You have their 3 conditions, right? And they get so into it that they kind of forget what's happening in the big picture. But you guys were all over it, man. So I thought that was solid.
Awesome. Yeah.
What is this apparatus?
Yeah, so we'll talk about that. You want to
Yes.
explain the Lucas?
That is St. Lucas. So
Yes.
this is a CPR machine that all of our ambulances have. And what it does is that, so like right now it was 5 of us probably working, and you were doing CPR. Us humans, we get tired, right? We get tired really, really quick. And even if we're switching out, it's only 80 degrees right now, but if it's a 100-degree day in the summertime, you burn out quick. And the more you do CPR,